My next guest, we are still staying in Asia, more specifically the Southeast Asian region. The next guest is from Indonesia. Um, this is going to be a very, very interesting talk. How can you use dentistry to stop deforestation? Hotlin Ompusunggu is one of the global leaders in pioneering new approaches in One Health, the idea that healthy people and a healthy environment are inextricably linked. Her incentives program has been a huge success in protecting rainforests in one of the world's most biodiverse regions, Indonesia. So please help me welcome onto the Global Biodiversity Festival stage, Hotlin Ompusunggu. Halo Hotlin, apa kabar?
Good evening, good afternoon, good morning for all of you. And thank you for bear with me. And thank you for Global Biodiversity Festival for giving me a chance to tell the story of our work. So I'm Hotlin Ompusunggu. I am a dentist by profession and a conservationist by passion. Yeah, initially I was not even interested in doing conservation, but yeah, I learned even from the points of skeptical why donor pay a lot of money to save orangutan while I witness a lot of people dying of poverty. But then I learned that actually this orangutan is the farmers of the forest and they help planting the trees in the forest. So when they help the trees keep planting in the forest, it helps the forest to be protected. When the forest protected, it help providing the necessity for the community, which provide like water, which important for the drink and for household use, even for livelihood like planting the rice and even brushing the teeth. So I learned saving orangutan is actually saving lives. Indonesia is the most biggest archipelago country in the world, and there's so much that we have in our country compared to other country. And among those 17,000 islands, we have the highest biodiversity per meter square, and so much more to explore than just Bali. I want to bring you to Sumatra, uh, this beautiful rainforest, which is a home to thousands of biodiversity, flora and fauna, is a magical place with a lot of things to see and to experience. Um, yeah, as IUCN say that it has more than 200 mammal species and a lot of species of plants and birds. And also in Sumatra, we have two species of orangutan, orangutan Sumatra and Tapanuli orangutan. And many of these are in the category of critically endangered. So they are going to extinct because mainly because of loss of habitat and also some of that because of poaching. And orangutan, I don't know your my the audience who are listening to my presentation. Actually, orangutan have its own meaning in our language. It's orang and hutan. It mean orang mean people and hutan mean jungle forest. So orangutan actually mean forest man, people and forests. And there are reality that there are community who live around the forest. These people, orang, and they live near the forest, hutan. They actually, most of the community who live near the rainforest are the community who usually live in a very remote area, and they live in a very poor condition. They have very basic infrastructure, and even some of the village you can only access by foot because there is no good road infrastructure. And also education also is very low. Many of the kids drop out from school, even from primary school, And these pictures on the left showing these 4 kids on their way to school. And it can take them about 2 to 3 hours on foot, yeah, just to reach to their school. And one of the kids here carrying this type of root inside those plastic things to sell to another village on his way to school. And many of these village also are the growing population, and many of the household that we found, they have 4 to 11 kids, and have less access or limited access to family planning. And they also have limited option for livelihood, and some of them depend on the forest. So they do some harvest to get some cash to provide their basic needs. Like one of these lady, they're collecting this root from the forest to sell to get cash. And these other pictures here, this man harvesting durian, which is also one of the favorite fruit for orangutan. And this is also my favorite fruit. And I agree with orangutan, this tastes like heaven. And but the thing is, the deforestation is very rampant in Indonesia, and many of this deforestation caused by illegal logging, in the high and small scale. Some of them by community, and also deforestation because of the open encroachment for agriculture. So we ask the community, we have approached what we call radical listening. We ask the community what they need to be able to protect the uh, forest, which is important for them, not just for them locally, but also for the world. And the radical listening means that we have to open our mind and heart and listen to their voice. And many times we didn't think it works, but actually it works. And the community know the best solution. Only they didn't have the resource to make what they want to do possible. They have limited opportunity. For example, we have this community meeting, radical listening, and most of these villages say that beside they have limited access to healthcare provider, they also have less income from rubber harvest. And they said that they want us to help them to increase the rubber price. And initially, I was skeptical even I put in my notes a smiley note. I cannot do something about it because it's the world situation. I don't have anything to do with that. But I exercised that. I said to myself, okay, even I think we cannot do something about it, but I write it down in the recommendation. And while I sharing this people's voice to people and other partners, then actually I found out that there are ways to help them to increase their rubber price. And this is an example that helping this community, we have to, yeah, make an open heart to receive what the community said. And we also uh, do interview with the household community who live near the rainforest. And we had this survey in 2020, and we survey about the economic, demographic, health and condition, and their perspective on the forest. We found that as it happened in most of the people who live near the forest, that they know that the forest is very good for them, it's important for their survival. Therefore, they also know that they should protect the forest. And 96 of our respondents say that the forest should be protected, and they need help to be able to do that. So from what we learned from the community and from our radical listening and from our survey, we designed a program, a project that help the community and at the same time also help protecting the forest. So help the forest and the people, help orang and hutan. So one of the things that we start, one of the pilot project that we start is giving the community an incentive to access our facility. So we designed this healthcare facility in one of the community near laser ecosystem in North Sumatra, and we have people can access to our clinic by providing seedlings. So it will decrease the economic burden for them to have access to medical care. As you can see here, we have the information how many seedlings that the patient contribute to pay for the medical bills, and this is the seed names, what the community pay for the treatment. And before we have this system in place, we also train the community what kind of seedlings that they can pay for the medical care. It's not just any seedlings, but it has to be seedlings that is native to the forest, and also the seedling should have certain condition like the height of the seedlings and the number of leaves, and it should have that condition. And we give them 2 or 3 months to prepare the seedlings, so they can get the treatment like today, and they can pay the treatment in 3 months and when the seedlings are ready. So these are this example of our database that the community provide the seedlings, the number of people who come to our clinic, number of seedlings, and also we know where the seedlings come from, and we're thankful for the support of ASRI Indonesia who gave us this location intelligence. So all the information from the information on the people, where they are, related to the forest, where the seedling come from, and where the seedling that we will plant, it all integrated in this database. So we have this information ready, and we have this to be able to evaluate our future intervention, and also this system will provide us information how we can escalate our program to reach out to more community, and also this system will also enable us to provide enough information to ask for a potential support and collaboration. And this problem with deforestation is a very complex, and we should do a very innovative way to address the issue of people and forests and orang and hutan, and we cannot do it alone, and we need the support of the global community, because this forest is not only important for the local community but also for the global community. And and please join us to support, to give this community a beautiful smile. As you can see, this lady in the center, she got her new false teeth by providing seedlings to our clinic, and we can help do more people by having more support from all of you. So please know more about our work and visit our website. And thank you for listening.
Terima kasih, Hotlin. Thank you so much. Can you hear me?
Yes,
Can you
yes.
hear? Perfect. Okay. Thank you so much. That was such a wonderful program that you're doing, and very, very innovative as well, because you've also managed to get the villagers to realize the importance of seedlings, and give the seedlings value, that they can exchange it for something else. I just wanted to ask a question. What do you do with these seedlings? Do you plant them elsewhere, or do you plant them in the village area? Where do they go?
Thank you for the question, Peter. Yes, uh, yeah, uh, yeah, I want to keep it short, so I didn't put more information. But yes, yeah, the seedlings that we get from patient, it meant to be able to be the seedlings to be used for the restorations of the degraded forest. So all these community live near the ecosystem that is degraded. So all these seedlings will be planted and will be monitoring as part of this rehabilitation work.
Oh, fantastic. I think that's a really, really innovative program. Something that we can also do here in Malaysia. Thank you. Encourage people to grow seedlings. I wanted to find out more about your plans to expand. You know, because Indonesia is so large. Do you have plans to expand this program also to include villagers from Papua, from Sulawesi, from Nusa Tenggara?
Yeah, of course, this is very a good innovation. Yeah, and I hope Indonesia still have a lot of potential for that. And yeah, if I have more partners to work with me, I'm happy to expand this idea. This actually already done in Borneo. I forget to tell because we have limited of time that this project also initiated in Borneo, where I co-founded Alam Sehat Lestari with a group of my previous team in West Borneo. So this is a type of bringing the idea from the past 2 decades that we work in Borneo to Sumatra. So Borneo and Sumatra already have this system. So I hope, yeah, if it uh, can help the other ecosystem in Indonesia or the world. So it should be something to think about and to yeah to dream.
Fantastic. Yes, and that's a great dream to have. I think more countries should adopt this, especially when we have indigenous peoples and communities who live next to forests, because we have to help them realize that the forest is precious and that it's worth more alive than cut down.
Yeah, and also from the survey we found that only 40% of the community who live near the high biodiversity forest has health insurance covered, but 60% still not covered by insurance. And this will be a good a way to reduce the economic burden for them.
So, just another question. So, on your medical panel, so let's say a villager comes with a few pokok-pokok, with a few seedlings to exchange, and what sort of medical advice can he get? Is it just restricted to dentistry, or can he get general health advice as well?
In Borneo, we have general and dentistry. So, because of this radical listening, this particular community, they have good general facility near the village, but they don't have dentists. And one of the village, when in this particular community, mentioned to me that one of the village member died because of just tooth abscess, and so uh, we need to like provide the incentive based on what they need. So this particular village particularly need dental care. That's why we provide dental care.
Fantastic. And how often does your team of doctors go to these villages? Is it once a month or once every 2 months?
In this pilot project, the team were there. Yeah, so we have clinic in the village, so the community can access to our clinic Monday to Friday, and from 8 to 4 p.m.
Oh, fantastic. So they're actually on site.
Yeah, they are on site. Yeah, we
Fantastic.
actually want to do some mobile clinic visit, so it will reach more people too.
Fantastic. I guess it's also a great way to engage the medical community who want to give back to the environment.
Yeah, yeah, this is pretty a new project that we start in Sumatra. As I mentioned before, we This is a project that were already done in the past 2 decades in Borneo. So this is bringing this idea of replication to North North Sumatra. So I still need a lot to learn and to expand. So yes, I cannot do it alone. If the community of medical experts want to join with us, we are more than welcome. And now we are exploring another forest community, and we're still learning the data from the survey we had last year. And in that community, there are also some basic needs for medical, general medical, but also um, dental care. This community, we found that only 11% of them seen dentists, and 72% experience toothache. So, yeah, this is the data that we want to follow up and to see what we can do to help them.
But how has the interest been from the villagers? I mean, do they want to see the dentist?
Yeah, we have quite. I mean, yes, dentist is not very popular, but when they are in pain, they have no other ways to come to our facility. But also, it's our job to do some education. Yeah, the they shouldn't come only when they have toothache. They need to have a prevention, and it become yeah, more popular when they have more information about their health. But also our clinic has been very popular for making denture tooth falls. Yeah, this is something it's not scarce for them, but they have been losing teeth. So when they know we can also provide them with denture tooth falls, yeah, it really encourages them to participate in the system.
I think this is again a terrific project that you're doing, Dr. Hotlin. I think it's wonderful that it's such a win-win situation. It's a win for the forest, it's a win for the villagers,
Yeah,
and
for
it's
us,
also a win for the medical professions.
yeah.
Is there anything that, let's say, if someone like in Malaysia or Singapore would like to help with your project, what can they do? How can they reach out?
Yeah, first they can find out more information in our website, and they can adopt trees to pay for the to generate some income to pay for the operational, and also yeah, I think we all have all the things that we can offer to help the community. So please contact us, find our website and talk to us, talk to me. And there's a lot of ways to help this community, because this is one of the pilot projects where other things besides medical. Also, we need to have some livelihood projects to support their economy. But this livelihood should be sustainable, good for the forest, and good for the health, like organic farming, good for the forest, good for their health. So there is a lot of experts that need to contribute to this project, not just medical, but also economic, agriculture, biologists. Yes, we should all collaborate to find the innovative integrating solution.
Yes, definitely. We can do this all together. Kan?
Yes,
Terima kasih, Dr. Hotlin. Thank you so much for joining us. I wish you all the best.
sir.
Sukses ya.
Thank you.
Stay safe.
Bye, everyone.
Bye.